chemotherapy did you have? Because your symptoms sound like neuropathy, where you get burning from the nerves of your feet due to some types of taxing chemotherapy. So I suspect that's probably what you had, and that it's not related to the medication that you're getting now. My other question would be exactly which pills. We have about 4 different kinds of pills that women can take for hormone receptor positive breast cancer. It sounds like you are probably on an aromatase inhibitor, which can cause a lot of muscle aches. And there's only one injection. Well, I guess there could be a couple. I'm not quite sure what injection you're getting. So it would be helpful to know exactly what that is. But there may be some other medications that you wouldn't have as strong a reaction to as far as the joints go. The toes, I'm concerned, are probably neuropathy. And depending how long ago you finished your chemotherapy, you may need to see a neurologist to get that diagnosed that there is actual nerve damage. Actually, B12 is a vitamin that I have B6, 100 milligrams a day of B6 vitamins is something that, a supplement that I have my patients take during chemotherapy to help avoid some of the side effects that may help you at this point, but it could be getting it diagnosed and wearing certain shoes that can help. Hard to say without knowing exactly what you were on. Hope that's helpful.
The follow-up question, she said, I also feel my eyesight is affected since I had chemo. Can you talk a little bit more about that?
Sure. Again, not knowing what kind of chemotherapy you were on. Some chemotherapies can actually block the tear ducts, and so can cause tearing and maybe some blurriness in the eyes. Again, hard to say without knowing what you were on. I would recommend, of course, if you haven't had a good eye exam with an ophthalmologist, to have your eyes examined. Also, not knowing if you have other types of illnesses such as diabetes or anything else that might have put you at risk for other eye issues, especially when you were on the chemotherapy. But I certainly would follow up with an ophthalmologist to see exactly what's going on.
Very helpful. So we have a question from Laura. Dr. Stebel, I'm a 45-year-old with a family history of breast cancer from my grandmother. I have been diagnosed with triple negative stage 3 18 months ago. I have completed 4 rounds of doxorubicin and later with Taxol and carboplatin since my tumor had not responded. I have completed the course and have been stable since then. What are my options if the disease progresses?
Well, Laura, I'd like to know if you had genetic counseling done to see if you have a BRCA mutation, because now it sounds like you're 18 months out, you have no sign of disease right now. If we could get you past at least 2 years, triple negative breast cancers can respond quite well to chemotherapy, and we have a higher cure rate. But it sounds like you had your treatment neoadjuvantly before your surgery, if indeed your tumor hadn't changed and you were switched to the other chemotherapy. So as far as your question about what happens if you should progress, I would want to make sure that you had genetic counseling, because there are certain drugs that we give specifically to women who have a BRCA mutation. So that's one thing. Secondly, there are other mutations within these triple negatives that we can give targeted therapy for. So there may be some other specific tests if you were to progress that can be tested to see if you can have the specialized kind of therapy. We also have, which is really exciting, we actually have another chemotherapy that was just approved this year, only for triple negative patients. It's being studied in ER positive, but that had such stellar data in patients that had been pretreated with a lot of different chemotherapies. It's had a lot of good success. So I would say that there are many, many, many options for you if unfortunately in the future you progress.
Wow.
But I want that genetic testing result.
It's really helpful to hear, just how fast, how rapidly there's more tools in the toolbox for oncology care
Oh,
these
it's been
days.
this last year in particular, I think we've had, at least 5 to 7 new drugs approved for metastatic cancer, early breast cancer, and we've had our first new drug approved for early breast cancer in over 20 years. So there's just been a lot of movement, a lot of understanding, and it is really an exciting time,
Wow.
encouraging time.
Yeah, absolutely. So we have a question from Jamie. I was diagnosed with HER2 negative breast cancer in my left breast and was told it was stage 2 back in 2019. I had a CAT scan, and what they found was that 2 lymph nodes in my chest between my lungs have cancer cells. So it was considered 2A breast cancer. I underwent lumpectomy, radiation therapy, and have been on Herceptin since then. When I went in last time, my oncologist spoke with me and said that the cancer has spread to more than 5 lymph nodes and diagnosed me with stage 3B breast cancer. Are there better treatments available than Herceptin? And would you recommend any clinical studies?
Well, okay, so first of all, how did you start that?
HER2 negative breast cancer?
Okay, so she's actually HER2 positive, most likely, if she's on Herceptin.
Okay.
Did she write out HER negative? Is that what you wrote out?
Yeah.
Well, if she's on
Yeah,
Herceptin,
even like the word is spelled out negative, if that helps.
well, so I'm a little bit confused. And if she's on Herceptin, then she's HER2 positive. I'm also a little bit confused about what these lymph nodes are. So I would say, have the lymph nodes been biopsied? Are they accessible to being biopsied? Have they been biopsied to document that they are really breast cancer and nothing else? Because if that's the case, and actually you would be a stage 4 if you have more positive lymph nodes, not a stage 3. That would be more distant mets. So that we need to get that all clarified. But as far as the question about, is there something else that can be used? There were 2 new drugs that were approved this year for HER2 positive metastatic cancer. One is called Tukysa, Tukysa, and one is called Enhertu, Enhertu. So both of these now are approved for women that have developed progressive metastatic disease. So I personally would like to get a little piece of that lymph node. And if that indeed is breast cancer, then you should probably go on one of these other generation HER2 directed therapies.
Okay. I don't see any further questions coming through, but I'd really love to get your take on what you see in your practice from from the time that you sort of take patients in. It sounds like you have a very whole person, whole wellness approach to the disease. So if you could sort of speak to that approach and what types of, how you sort of evaluate the case and how you go from there.
Sure. So I'll often see women ranging from coming to see me. Well, one thing that was mentioned in the family history, I do a lot of genetic counseling. So if I have somebody that's concerned about high risk, so we may assess them genetically for what their risk is of developing breast cancer and do testing. And then I have them in a high risk surveillance type of situation if they turn out to have a mutation, and see them back on a regular basis. So that's one prior to developing cancer. Secondly, when a woman comes in and she's diagnosed with cancer, it's really important to know the kind of cancer there is, of course, the age of the patient, what the degree of disease there is. I've seen some young women come in with very advanced disease and they already have metastatic disease when they come in to see me. Others come in with very small tumors. So it really is a matter of the biology. And we have so much more information about the biology. And that's why when we went back and about Laura's question is we have to know what the genetics of the family are. We need to know now different drivers of the cancer itself, because now we have specific drugs that will target those markers. So, but that's the medical part of it, as you said, Whitney. But then there's the family side of it, and there's the personal side of it. And so that's when we come down to discussions about your surgical options or what the treatment is going to be able to offer you. My goal is to have women not die of breast cancer. What can I do about that? And keep them living their lives. I mean, I had a woman who her date night was her chemo night. So after her chemo, she would meet her husband down at the beach and they would have dinner and a bottle of wine. And so it was, you take a bad situation, but then you try to turn it into something that is more reasonable. At least, some other pleasant things. You go on with your life. I had a young woman, she was 35, and she was getting her master's degree and she had a full-time job. So she had access to my computers and there I would be, or to my internet. So she'd be on her conference calls and she would be doing her schoolwork while I was trying to stick all of her lines in, giving her therapy. So, just you live your life. This is a bump in the road, but you live your life.
Yeah, absolutely. Are there any sort of routine screenings that you do from a nutrition or, vitamin mineral reserves type route in order to inform the supplement treatment plan?
Sure. So depending on what kind of chemotherapy that a patient is getting, like with Sue's question, if I'm giving a certain chemotherapy that I know can affect the small nerves and fingers and toes, then I'll put them on certain B vitamins. We have, contrary to what people want to believe, nutrition has really very little to do with breast cancer treatment. Vitamin D supplementation is something that we have found to be very important because that can help the bones. So I always make sure that women are getting enough vitamin D because we're wearing sunblock. Nobody's really getting enough sunshine for vitamin D. So I will supplement with vitamin D. There may be there are other supplements that I may use if patients are having certain side effects from their treatment. If they're having hot flashes, I may add on soy or black cohosh. If they're having some mood swings, then I use red products like red clover or rooibos tea products. I like valerian root if people are having problems sleeping and they have a lot of anxiety. So I try to, supplement the side effects with actual plant-based products rather than start just throwing on pharmaceuticals.
Yeah, no, that's fascinating.
And exercise. Exercise is really, really, really important. So we recommend 3 to 5 days of really rigorous exercise. Walking a good pace so that you're a little bit short of breath, at least 30 to 40 minutes. And that helps your bones also. It helps strengthen your bones. It helps to decrease the fatigue that you may have with treatment, with chemo or radiation. Light weights, 3 to 5 pounds, build muscle weight, muscle mass. That also helps your bones as well. So yoga has been found to be very, very helpful with breast cancer recovery. Tai Chi, I'll recommend a lot. And actually, I keep my acupuncturist pretty busy as well.
We had another question come in from Shadow. I am a 42-year-old woman and have recently had a skin/nipple sparing left breast mastectomy with reconstruction 6 weeks ago. I had a grade 3 92 millimeter HER2 positive tumor. which was also estrogen and progesterone positive. Both sentinel lymph nodes also tested positive with macro mets and other, extracorpuscular extension.
Mhm.
I am very nervous about chemo and would like to explore any other options I have, if any. I do not want to take any risks with my life, but worry about all of the harmful effects that chemotherapy may have on my body. I'd appreciate any insight.
Yeah. Sorry, Shadow. Again, did you have genetic counseling done? You're 42, you're young. Honestly, so I'm in Southern California, and this is, I think, the land of holistic medicine. And I can tell you how many patients I saw in your situation who chose to go an alternative route that did not have a good outcome. These tumors are curable. These are potentially curable. But unfortunately, the only way that we're going to be able to get there is by using chemotherapies. Yes, there are side effects associated with the chemotherapies. However, they are very, very manageable. I had, I had a woman in a similar situation that I was treating, and she was doing so well that when she would ask for time off from her job, I'd have to write her notes because she was doing so well that nobody would believe that she was really sick. So fortunately, nowadays, we have so much supportive medication to help with nausea, to help with infections, even some manipulations to help with hair loss. But this is a curable situation today. It may not be 6 months down the road. So like I said, I will allow a lot of complementary care in my practice, but my patients also would have to know the way to cure it is with my drugs, with my chemotherapy. And unfortunately, that's the only way.
Yeah. Yeah, no, it's certainly important to sort of use all of the tools of modern medicine, right? And
Right.
then to sort of augment what you can with health
Yeah, this
and
is
lifestyle.
your one shot, your one shot, your one opportunity, as Eminem would say, for cure.
We have a question from Melissa, based in Australia. It's sort of dually about breast cancer and melanoma. It almost seems a little more melanoma focused, but I'll relay and you can
Sure.
tell me what you think. I was recently diagnosed with breast cancer and melanoma in my back on the same week. Not a fun week. Invasive carcinoma, waiting for my PET scan. I'm going to be over a month waiting because I did not want lymph nodes taken with my back melanoma. So I'm waiting but I can feel like it's spreading. The back is stage 4 times 2, one not so bad, the other one aggressive. I presume this is referring to the 2 spots of melanoma. The worst, and breast out of 3, stage 2, PET scan next Tuesday. There doesn't seem to be like a full question kind of tacked onto that. Sorry, I was trying to read through
Sure.
as it was coming in, but I guess maybe a comment on what happens in medicine when certain screenings get delayed and how to sort of handle that.
Yeah, this has been a tough year as far as screenings being delayed. You're from Australia. I believe that there is a pretty high incidence of melanoma in Australia with the sun exposure. You're another one, Melissa. You really need genetic testing done because BRCA mutations and PTEN mutations can link breast cancer and melanoma. So definitely you want to see a genetic counselor for that. It sounds to me like your highest risk is the melanoma. Again, not knowing what you have had done thus far, I would certainly recommend having any excision. And I know, the lymph node excisions, you don't want that. That's going to be the best way to be able to really stage you. Melanoma too has had a lot of really new innovations, especially with immunotherapies lately. And that's another thing with breast cancer, especially the triple negatives, where we have immunotherapies that are available to us based on the type. So I would certainly want to do as much as you can for that melanoma, the genetic testing, and see where that is. I mean, if you're feeling like things are spreading, I would want to be the most aggressive with that.
Yeah,
Yeah.
certainly.
Sure.
Another question came through from Irma. I have breast cancer stage 2A. I am 62 from the Philippines, ER/PR positive and HER2 negative. I was advised to have 6 rounds of chemo. I'm done with the 3rd round. My bottom nails are starting to turn black. Is there any foods that I should eat or not eat?
Sounds to me like you're getting a taxing. Those tend to make the nails turn dark. Yeah, I'm just wondering why, not knowing how much chemotherapy you're supposed to be getting, what was recommended, and how much more you have left. Unfortunately, there's not much that you can do about those nails. You may try to just put on, there's no nutritional, no foods that's going to help. It just it's a side effect of the chemotherapy. Again, I have my patients take B6. Sometimes that will help, again, nourish the cuticles. You could try some cuticle creams or oils, but unfortunately, you just may lose those nails. They'll grow back, but you may lose the nails.
Oh. I'm curious how much you have, enrolled your patients in clinical trials and what that sort of landscape is like as a treating physician.
Right. So I don't do now a lot of clinical trials. I have referred for clinical trials. I've had a few that I have participated in. I think that it's good for, if there is a clinical trial available, to have as many people enroll as possible. That's the only way that we get the information. So it depends on, particularly with very high risk early breast cancers, or the triple negative breast cancers, the metastatic breast cancers. Sometimes it's hard to get into a trial. It depends on what the qualifications are, but I totally support, if you can do it, then you should do it.
Arlene came through with a question. Good day. The COVID vaccine is okay during my rest days of chemo? ? Like me, in a month, I have 3 Fridays of chemo and then rest for 1 Friday. During these rest days, the doctor allowed me to have the vaccine. Does this sound fine?
Yeah, you know what I do with my patients actually is I have them wait 14 days from getting their vaccine. So I just hold their chemotherapy for 14 days. I've done that with every round of COVID vaccines that they've gotten. There's no hard rules right now. That just seems to be the dogma with most people, waiting 14 days. So it's not a problem, getting it during that week. So you haven't, so I'm just confused, Arlene. So you have had it or haven't had it. If this is your first COVID vaccine, I would talk to your doc about maybe waiting another week, having 2 weeks off.
Ahead of the vaccine or after?
After.
What's more relevant? Okay.
Yeah. So you have the vaccine and then you wait for 2 weeks until you get your next chemotherapy.
Yeah, it almost sounds like if she were to go after, the Saturday after one of those Friday treatments, and then the week before she has a rest, she'd practically be at the full 2 weeks.
Right, exactly. Yeah. And it doesn't seem to matter with radiation, just with the chemotherapy. It's the same thing with flu vaccines. I have my patients actually wait a month if they are on active chemotherapy. It takes about a month to get good antibodies from flu vaccines. So that's the main thing, is you want to be able to build up your antibodies without having a suppressed immune system, so you can't really mount the response that you want to, do. So that's why I do the 14 days.
Okay, that's helpful. Amanda asks, hi, I'm 36 with stage 2 invasive ductal. Ductal, I'm assuming she's missing. Okay, missing a T. 2 out of 9 lymph nodes affected, oncotype 16. I'm also pregnant, currently 28 weeks. Oh, all of my genetic tests were negative. HER2 negative, HR positive. I already had a mastectomy on one side. Thoughts on chemo and what to use, and estrogen blocking medications after delivery, radiation, question mark.
Yeah, it's so funny. I'm so confused here. I don't even know why the oncotype was done. Because in somebody that has 2 positive lymph nodes hasn't really, in premenopausal, hasn't really been validated. A score of 16, though, indicates that chemotherapy isn't going to benefit you. So I'm kind of curious why that was done, but you're getting chemo anyway. I have treated your 28 weeks. So that's getting close to the end of after your second trimester, going to your third. I've treated a lot of women that are pregnant. So there are drugs that you can give safely during pregnancy. The studies that we've looked at children after women have gotten the chemotherapy during pregnancy have done just fine. There's not been any issues with the children. There are some drugs that you cannot give during pregnancy. And so I'll usually use some drugs up front, let mom deliver, and then give the other drugs such as the taxanes on the back end. So that's not a problem. You'll be fine. Also, there's no indication that getting pregnant a second time after, or getting pregnant after a diagnosis of breast cancer increases your risk of developing another breast cancer or developing metastatic disease. So don't let anybody tell you that you can't have any more children. You're young, and so most people would probably want to, after the child is born, and you're getting the rest of your chemo, if you are, then most people would want to give you injections to suppress your ovaries, ovarian suppression. There are some studies going on where we're giving ovarian suppression with hormones to women for, say, 2 years, and then stopping their ovarian suppression, letting them have another child, and then starting over again to finish up a 5-year treatment, which is what we usually give with hormonal therapy. Those studies are ongoing. So you have lots of options to be able to consider having another child as well, even if you were to freeze eggs, at the end of this pregnancy before you started more chemo and the suppression.
Wow. Do you ever see that they induce early to be able to treat okay, so they let everyone go?
The only thing, I mean, when we have gals coming in, and I don't, the only time is if we would interrupt the pregnancy, if we would have a therapeutic abortion, if a woman was found to have a very, very early pregnancy and a very aggressive cancer, then at that time we may think that we may recommend that she abort so we could treat her. But we've never induced early to have a child, no.
Okay. Dulce commented, good morning here in the Philippines. I just experienced last night with my left thumb. I'm not sure if it's a vein that starts to turn violet, the color. And I'm in pain as if it will burst. I just immediately hot compressed it and sprayed magnesium oil that made it relax and subside. What may be the cause of it?
Well, Dulce, I'm not quite sure. You injured it in some way. I would think that you ought to have somebody take a look at that thumb and try to figure out exactly what's going on there. make sure there's not a blood clot. If you'd injured it in any way, might have broken your thumb, I would recommend you have somebody look at it.
Fair enough. Yeah. Arlene, who actually asked,
About the COVID, yeah.
yep. While on chemo, are herbal supplements fine to take to fight side effects of chemo, such as barley and food algae?
Is it barley she's asking about, and what else?
And food algae?
Oh, algae. Okay. That would be okay. I ask my ladies to not take antioxidants during chemotherapy or during radiation. Antioxidants such as omega-3 fatty acids, vitamin E, turmeric. What other kind of supplements are out there that women will often use? So those are the main things that I don't want women to take during chemotherapy. But I don't think that barley and algae, as long as they're not high in the omegas, I think that should be fine.
Okay. We have a little lull in questions for the moment. Is there anything that you kind of want to make sure that you're, communicating to this audience?
Yeah, you brought up with me about a screening, and I'll say that there's a lot of perhaps some over screening going on. Women may be getting MRIs where they don't really need MRIs. Also, the question about genetic testing and prophylactic mastectomies. I think we need to just kind of take a step back and think about what really your risks are for developing breast cancer. The recommendations at this point is, if you have a mother or a first-degree relative with a history of breast cancer, we start screening 10 years before they were diagnosed. Otherwise, you start screening mammograms at age 40. So for instance, like you have a couple of young women on the call, like Shadow, Laura, and Irma, where their girls would want to start screening a little bit earlier. Otherwise, it's age 40. There's really no role for screening MRIs unless you have a BRCA mutation. And sometimes you can find these little ditzels that don't mean anything, and you end up having a biopsy that unnecessarily that builds up breast tissue, and then it causes more confusion later on. So I would just want to talk about any concerns that you have, but those are the screening recommendations. Even after a diagnosis of breast cancer, we usually just go back to annual mammography unless you're not other high-risk group.
Is there anything along the sort of survivorship component of this journey that you want to speak to, or that you can comment on in terms of how frequently you follow up with your patients and what you see in practice?
Yeah. So I see my patients actively in treatment every month. Once they finish treatment, I see my ladies or men every 3 months up to 2 years, and then every 6 months after that. I no longer go to annual follow-ups because I've seen a couple of people kind of fall through the cracks where their primary care doc didn't really understand a certain complaint that they had come in with, raise a concern for metastatic cancer. So I see my ladies every 6 months after 5 years, and I see them forever and ever and ever. I have seen breast cancers come back 15 to 20 years later. So that's why I follow people, closely for a long period of time. You can basically go back to your regular activities. There's nothing different that you need to change in your life. Nobody knows what causes breast cancer. Estrogens do not cause breast cancer. So if you got a breast cancer while you're on hormone replacement therapy, you didn't do it to yourself. The hormones didn't cause the breast cancer. So I just try to be sure that women are, I will monitor bone health, make sure they're getting bone densities, make sure they're getting their mammograms every year, and follow them up that way.
That's wonderful. It sounds very thorough. I'm sure all of your patients really appreciate that. We had a question come in from Joan. I am 40 with stage 4 ER positive, HER2 negative breast cancer. I was on Femara and Iberance since 8 months, and the latest scans show mild metastases to the liver. I have severe fatigue. What would you recommend for further treatment? And is there any medication that I can take for the fatigue?
Mm. Well, number one, the fatigue, if the fatigue is due to the cancer progressing, then we need to treat the cancer. Then you're going to feel better. There are some drugs out there. There's a drug called Provigil that I will sometimes get for my patients that are having really severe fatigue that helps with energy level. But since you've been on this Ibrance, and again, not knowing, there are two questions here. Number one, how soon after your original diagnosis did you develop metastatic disease? And how long have you been on the Ibrance and Femara? She didn't say that in the question, did she, Whitney?
No. Well, she said that she's been on it for 8 months.
For 8 months, I'm sorry.
Yeah.
For 8 months, okay.
Yeah.
Thank you. So that you're seeing some progression now that's probably been going on for a little while. Your doctors may be able to switch out the Femara for another drug called fulvestrant. That's an injection, a monthly injection in the butt. One thing that we're trying to figure out with these CDK inhibitors, of which Ibrance is one of in the family of that, is if we should switch to another CDK inhibitor or switch out the hormonal partner. So if I were seeing you, I would probably switch out that hormonal partner. You may have fatigue due to the Femara. You may have fatigue due to the cancer progressing. So that would probably be the easiest thing to do, is see if your doctor would talk about switching out that Femara to something else. And then I just have to see how the cancer is doing, how it responds, and then your fatigue may get better.
Arlene chimed in with another question. Are meats and sweets fine during chemo? Now I'm on chemo with my diet more in a plant-based, brown rice, fruits, assorted nuts, except peanuts, organic eggs, select fish. I also eat soy powder and tofu. Is fine or lacking, especially for protein. I avoid meat, sweets, and dairy products. Is this okay?
Yeah, I mean, it's okay. It's not necessary. It's a healthy diet, so that's always good. It's not necessary. I know that there is some beliefs out there that sugar feeds cancer. Again, I haven't seen any good randomized data to show that it makes that kind of effect, eating sweets or not. And the soy stuff is fine, all your plant-based. And so was she had a concern about getting enough protein? Is that what she said?
It sounds like it. It sounds like she's using soy powder and tofu to ensure she's getting enough protein.
Yeah, so you want to be sure that you're getting essential amino acids. So there's a product out there called nutritional yeast. So it's really, really good. I'm vegetarian, and I'll make a vegan or have vegetarian, and I stay away from dairy products just because of intolerance. And this nutritional yeast is so good. I make macaroni and cheese with it. I put it into soups as a thickener, and that has a lot of essential amino acids in it. So that's what you really want to be able to get. And you want to, if you can get some books on combining foods that make complete protein, such as rice and beans. They make a complete protein. So try to educate yourself or see a nutritional counselor to see about how you might be able to combine some foods to help get more of a protein boost in there.
I will plug OncoPower. So we have a registered dietitian that can answer all of these questions for you, Arlene. Rachel Spencer, she actually did an Ask a Doc Live session recently where a lot of these sort of sugar and protein questions came up. We will be posting some of the video that related to those questions. So you'll be able to find it on OncoPower in the coming weeks. And she will also be launching a series in January targeting 4 major topics within nutrition and oncology care every single week. It'll be sort of like a 15-minute intro to the topic, followed by question and answer session. So I would encourage you to sort of stick with us, make sure you're registered on the platform, and we can help make sure that you get all of your nutrition questions answered.
That's excellent. I have to get my ladies to sign up too.
Yeah, absolutely. We had another nutrition question come through regarding protein options for cancer patients who are vegan.
Mm-hmm. Is that the question?
Yeah.
Yeah. I mean, it's hard. It's really hard. So I'm a lacto-ovo vegetarian, although I don't do much dairy just because of intolerance. My daughter was hardcore vegan, and it's hard. It's really hard. We both developed B12 deficiencies because that's the only place that you get B12 is out of animal protein. So that's kind of where I had to educate for my family and, for my patients as well, how to combine these things. Again, I don't know if Rachel discussed nutritional yeast, but I will certainly plug that.
It is a great source of B12.
Yeah, it's a great source of essential amino acids. And it just adds so much to your food, especially if you're vegan. To make vegan mac and cheese is the best thing ever. And combining, there are certain grains, lentils that have more structured protein. Again, I would defer to Whitney and her nutritionist, who could probably give you a lot better information than I. But it's tricky. You have to work on it, but it can certainly be done.
Yeah, no, certainly. Again, I would encourage going to the OncoPower platform and dropping that question into the feed, and you'll get a nice, thoughtful response from our registered dietitian. Irma has another question. After I'm done with my 6 rounds of chemo, is there a need to take cancer medicines as a maintenance?
Cancer medicines as a maintenance, she said?
Yes. She had previously asked about breast cancer stage 2A, 62 years old,
right.
ER/PR positive, HER2 negative.
She's ER/PR positive. She's 62. Well, I would imagine, Irma, that they're going to put you on hormonal therapy, on some pills for at least 5 years. There is a test that can be done. We don't know what's optimal. 5 years. Some women need to go out longer, to maybe 10 years, but there's a study called BCI, Breast Cancer Index. And they take your tumor, they look at specific characteristics of your tumor to see if you would benefit from what we call extended adjuvant therapy. That's taking adjuvant therapy and increasing it from 5 years to 10 years. So that's something. I know you said you're in the Philippines, I believe, but I believe that can be done there. But yeah, you'll be on some type of oral hormonal agent for at least 5 years.
With all these questions coming in from around the world, how standardized is oncology medicine around the world? I don't know enough about it. So
yeah, it's interesting. We every year in December, we have a big symposium called the San Antonio Breast Cancer Symposium. That's when all the new breast cancer news comes out. It's the largest attended conference, and I would say that 3/4 of it are international. So things are pretty standardized. The only things that are sometimes a little bit different, for whatever reason, some chemotherapies are less expensive in other countries than they are here. But and so, or vice versa. So sometimes there may be a little bit difference in class of drugs, but you know, the cancers are the same. It's all the same language, you know, your hormone, what your hormone receptors are, what your pathology is, what standard chemotherapy. We have all these guidelines that we follow. So there's two major groups. One is called ASCO, which is the American Society of Clinical Oncology, and then ESMO, which is the European Society of Medical Oncology. And they just really, really correlate. We have papers coming from both sides. So I've had people come here from Europe. I've had people come from Saudi Arabia to see me. And it's pretty standardized. Yeah.
To sort of follow on to that, would you mind commenting on how you see more, you know, this burgeoning world of telehealth and telemedicine playing into some of these like treatment decisions that are starting to be made, to be able to be made, you know, with people that are halfway around the world?
Right. So I participate on a couple of panels where patients, I think, where were these patients coming in from? I know I had some from China. I had some from India, where they would want an expert opinion. So they would send me records that but that's been going on even before COVID. I get the records. They just want to talk about their case. And then we have a video chat about their case. And I send the consultation back to them that they can go over with their oncologist. So I think that's certainly something that, golly, since all of our conferences have been virtual now for the past 2 years, I think it's something that, you know, it's going to be easier to be able to handle. The only thing is that you can't examine somebody. So it's like to go over results, to go over questions. You can only do so much.
Right. Yeah.
Definitely expanding.
Yeah, definitely. I don't see any further questions coming through. We'll give everyone a few more minutes before we totally wrap this up in case there are any last minute questions that come through. But I have to say, Dr. Stebel, it is such a joy to talk to you today. You are so knowledgeable, and I really appreciate sort of hearing your approach with your practice.
Oh, thank you. Appreciate the opportunity. Would love to know what happens with everybody. Thank you so
I
much.
know. Yeah, that's a good point. That is the one thing about having these live sessions. I think people really appreciate getting another opinion and another voice, another, you know, trusting source. But yeah, we don't totally get the follow-up unless they go and post something later in OncoPower.
Sure. Well, great. This is a really great a service that you have for patients out there. My hat's off to you for doing something like this. I think it's absolutely wonderful. Thank you for the invitation.
Thank you. We appreciate that. We had Sheila come with another question, or her first, I think. Would love some advice on how to boost my immune system. I'm a breast cancer stage 3B patient.
Well, Sheila, I mean, boost it because you're on treatment right now. Boost it to help fight the cancers. I'm not quite sure exactly what you want to boost. Your immune system is not, I mean, I guess the best way to really boost your immune system is to get the vaccines that are available to you, because that'll help protect you from other diseases. We do have some vaccine studies going on in breast cancer right now, but nothing available as far as vaccines and breast cancer yet. So I would say that staying healthy, there's not much you're going to be able to do to your immune system itself, but staying healthy so that you're able to take the treatments that you're getting to help fight off the cancer. You
Yeah.
can tolerate the treatments.
Yeah, absolutely. I would probably just add to that staying active for as long as possible.
I mean, I had one of my ladies that her office was probably, I think, 3/4 of a mile down here to radiation, and she ran to radiation and back every day. So
Wow.
that's what she did.
Yeah.
And yeah, got to stay active.
Yeah. Yeah. Wow. All right. Well, Dr. Stebel, again, thank you so much for your time and expertise today. This has been really wonderful.
Okay, and to all you brave ladies out there, keep up the good fight.
Yeah, absolutely. Definitely some strong women out there.
Strong women. Thank you so much, Whitney.
Thank you. And to everyone that joined us today, thank you so much for your time and for your questions. And, as always, please join us on OncoPower, and we're here to support you through the entire care journey. Thank you and have a great day.
Thank you. Bye-bye.